In the aftermath of a global pandemic, the quest for health resilience has never been more critical. Yet, as Europe strides towards recovery, the vital question remains: is health truly a priority in the EU's political agenda?
Health has fallen down the agenda, and that's very understandable because of other crises. But what we must recall is we need to be prepared for looming health crises that are on the horizon. Climate change is going to pose a huge health burden that we need to adapt to. And then we have the looming crisis of antimicrobial resistance. But then there's also those economic interests who feel that the progress we're seeking to protect people's health actually have an impact on their business, on their commercial activities. An example I would give of where these commercial interests have been very strong is in alcohol, and we saw how much they pushed back against the legislation in Ireland, and we've got plenty of material on our website as to what happened because of the Irish law to just label alcoholic products with a health warning. That is played out in other sectors as well. So what we are seeing is what's called the commercial determinants of health. The real commercial actors are pushing back against the progress we want to see in areas which policies will help and achieve better health for all. So we really do try to ensure that we tell a story, that we communicate how meaningful this is to individuals and relate their story to really present the people behind the numbers. Some of these stories are to do with healthcare access, whether it's rural communities facing challenge, or whether it be people with mental health problems not being able to access quality care. And other times it's to do with housing conditions and making sure people have adequate conditions to enable them to have healthy lives. Whilst other stories really demonstrate what impacts on people's health there are from issues like air pollution or noise pollution. I think it's important we outline what our main priorities are for protecting public health at a European level. The first is that there is real political will dedicated to health and making sure that that's reflected in the institutions. The second is that those institutions need access to budgets that are large enough and allocated to health to be meaningful. The third is that we fight inequality and social exclusion so that everybody has access to health. And fourthly, we need to look at the healthcare sector itself, making sure that there is enough healthcare workers and that there is enough medications available. And then finally, we need to make sure that healthy environments are provided so people really are empowered and have choice and aren't blamed for poor lifestyles but are provided with the real options. Every 5 years, all Europeans are asked to contribute to the direction that the EU takes. And this is your opportunity to make sure that health features in that future and ensure that decision makers incorporate health as part of their political legacy. When you decide how you're going to vote, make sure you incorporate health in that vote. And the way you can do that is look at our website to see what we have demanded of politicians and how aligned each of the parties' manifestos are to those demands.